What is mindfulness?
How to practice their mindfulness.
Paying attention to the present and being non-judgmental. So we judge ourselves a lot. If you are living with rheumatoid arthritis or any other chronic condition, or if you are caring for someone who has this chronic condition, you know it's not just about joint pain. It's about reclaiming your sense of control and peace. Today, we are honored to have Dr. Nirali Dubal with us. Dr. Dubal is an ICF certified life coach and a certified meditation teacher. After a long and fulfilling career in practicing medicine as a pediatrician, she recently retired to fully dedicate herself to her bigger purpose and her bigger passion, guiding others towards inner peace and purposeful living. Through mindfulness, meditation, and coaching, Dr. Dubal helps individuals reconnect with themselves and create more intentional and fulfilling lives. You can learn more about her work at niralidubal.com. And today we will be learning more about this with Dr. Dubal. Dr. Dubal, thank you so much for accepting our invitation, coming in our YouTube channel and helping us learn more about your expertise in mindfulness. Let me start with a quick introduction about you. If you can tell our audience what is mindfulness and how you have been doing the mindfulness to help patients and other people on their chronic conditions.
Thank you for having me, Dr. Subedi. I am a pediatrician, and I went into the path of mindfulness a few years ago. I started doing more regular meditations in 2017, and then started doing it more regularly when I started training to become a teacher. And I have been helping people learn how to center themselves and how to practice their mindfulness and meditation on their daily life.
Okay.
Small things as well as bigger things, and
Okay.
it can help with both of them.
Yep. Now, for some of the audience who may not know us, may not know our channel, so we focus more on rheumatoid arthritis and other chronic autoimmune conditions. But what we'll be talking today expand beyond some of the common chronic conditions. So even other chronic conditions, there is importance of mindfulness and how you can stay centered to take better care of your health. So we'll be focusing on other chronic conditions too, not just rheumatoid arthritis. Now, to make it a little more simple, let me start with asking a simple question. So, what is mindfulness?
So, mindfulness is not this big thing that is abstract. It is very simple. Mindfulness is what you pay attention to something with intention in a non-judgmental way, without judging, paying attention here and now. It's that simple. And when you do that for a longer periods of time, paying attention in a non-judgmental way, then we call it meditation.
Got it. Okay. Now, to make our audience a little more easier to understand, what are those two things? What I heard is one is paying attention to the present and being non-judgmental. Now, the first part I understand very well, but let's make it a little more simple on what it means by non-judgmental.
What I mean by non-judgmental is whenever you are paying attention and trying to be mindful, you do not need to criticize yourself or judge yourself. Am I doing this right? What is going on here? We have a tendency as human beings to criticize ourselves a lot, and it helps when you don't be judgmental or critical to yourself.
Got it. Okay. Yeah, and many of you know our society is so critical, right? Whenever you do one thing, people usually put comment. And since we live in a judgmental society, we are tuned to the habit of judging everything, including ourselves. So we judge ourselves a lot, right? We self-critical a lot. So it looks like non-judgmental part is not criticizing yourself, just feeling what you truly feel and then not making any judgment, either good or the bad. I think that's what I got. Is that correct?
Precisely.
Okay, excellent. Now, when we talk about the mindfulness, what are the other things many of us are doing every day we are not being mindful to? Like what are those things that we can be mindful to?
So the little things in life, like most of us are on autopilot most of the time. Like, do you a lot of times, has it happened to you that if you're driving from one point to the other point, you get in the car and you don't remember how you got there? You are eating a meal and you don't remember how fast you finished it and what did you eat and what it tasted like, or was it today or yesterday? Sometimes you don't remember when was the last time something significant happened to your children. So we are all on autopilot most of the times, living in the future or in the past. And by learning to be mindful, coming back to the present, we are able to enjoy our life more.
Got it. Okay. Now, some of the common point that you brought up, like even eating, right? Now, when we eat, the eat has so many flavors, right? Many of the time we eat for eating. We don't enjoy the meal. Now, can you tell a little more about our audience regarding that, what we call a mindfulness eating or mindful eating?
Yeah. So, especially in my experience as a pediatrician, I have seen that kids, since they are very little, they have been sitting in front of the screens and eating because it's easier, because they can eat mindlessly. But it's so much easier for the caregiver to help them eat easily, because they're not going to refuse, or they're not going to say, I don't like it, for the most part. So, mindful eating is when you are not distracted while you're eating. You are not checking your email while you're eating. You're not watching social media. You're not watching your YouTube while you are eating, and paying full attention to your food and what you are eating. And that gives you more satisfaction. And it helps you pay attention to when you are full. And instead of going automatically for the seconds, if you are paying attention, you are not going to go for second servings, and you're not going to overeat or undereat.
So it looks like that might even help you on combating your obesity problem, right? So if you can
Absolutely.
mindful eat, you eat what you need, not overeat. So that might be even secondarily help you on the obesity problem too.
Yes,
Now,
absolutely.
sorry. Now, to help our audience to really learn about what is mindful eating, so what they can do, practice every day when they are eating, what other thing they can do, what other thing they should not do.
So, one thing I would definitely emphasize is not to eat in front of screens. Put your phone away, especially if you're having a family dinner. Have every member of your family put the phone away where nobody can go back while you're eating. Put all the notification to silence, and try to enjoy your food as well as the time together. So, if you were just going to do one thing, I would say meals without screens.
Got it. Okay. Okay. So that's one of the strategy of being mindful while you're eating. And you can also enjoy the flavors too. Like if you are paying closer attention to what you are eating, you can enjoy both the smell of the food, the taste of the food, and also the texture too. So that might be the truly
Absolutely.
a mindful way of eating, so that you truly enjoy your meal, and also the family time too, right? The time you
Yes,
spend with your family,
the connection.
the connection, that is a precious time where you spend a quality time both enjoying the meal as well as also enjoying the time with them.
Yeah, my kids don't always like that rule, but I try to enforce that as much as I can.
Yeah. Now, with that topic, so how do you educate your kids, your other people, or why it is important to do mindful eating? What are the strategies you use in your home?
I don't think I can say that I'm very successful at that in my own home. But we do have a rule that at the time of family meals, we don't have phones on our dining table. And while you're eating, you're not, even if you're by yourself, you're not allowed to be on your phone watching something, just to kill the time.
Yeah. Yeah.
So that's one of the main things I enforce at home. And sometimes I'm tempted also to go ahead and watch something on my YouTube, or want to listen to a podcast, and just make use of that time.
Yeah.
But
Yeah.
instead of using my time, I am not paying full attention to my meal.
Yeah. Yeah.
So it's very tempting in our fast-paced society to wanting to do two things or multiple things at the same time. But when you are doing one thing at a time, it is much more. It's done much more um, appropriately,
Yeah. Yeah.
and with proper attention, and it has more better outcome from whatever you're doing.
Got it. Okay. So that might mean that less is more in this situation, right? You do
Absolutely.
less things when you are eating. So try to focus on your kids, focus on your family, focus on your food that you are eating so that you can truly enjoy. You have less distraction. So that is what we call less is more in this situation.
Right. Exactly.
Yep. Excellent, excellent. Now, any other, like we talk about the mindful eating. So what are the other everyday things we do where we can apply the concept of mindfulness?
So mindful eating is one, and then just when we are spending time with our loved ones, our family members, if we are trying to do multiple things at a time and not mindful, we're not present
Mhm.
with our kids. I remember many years ago when I used to play Candyland a lot. Candy Crush, yes, that's the game I used to play a lot. And my little one, my son, one time said, "Mom, when you are playing Candy Crush, you don't listen to me."
Yeah,
And I realized that, and I deleted the game.
yeah,
But all those things are very addictive.
yeah.
And we, even though with all good intention
Yeah.
to spend time and pay attention to our children and
Yeah.
our loved ones, when we are not mindful and we are automatically doing that because
Mhm.
you're addicted to it, you miss the opportunity
Mhm.
to spend time with your loved ones
Yeah,
and
yeah.
connect with them.
And sometimes I do that too. Like sometimes I put my earpod and I'm listening to the podcast or other books, and I'm talking with my kids too. So even though I'm trying to be productive, but actually I'm not being productive. I'm trying to multitask, but that's not multitasking. I'm just not being present for both. I'm not listening to this, and I'm also not focusing with my kids too. So we, all of us, are culprit on doing those. We just need to be mindful. Now, going back to the term of mindful, this is another way of how we can be mindful of our present, truly being present with someone you truly love. I think that how we can, even is a respect for them too, right? If they are spending time with you, they are giving you full time, we should respect them back so that we can give them our undivided attention.
Yeah, and giving our undivided attention to anybody, either it's your family, your kids, or strangers, is the best, most important way you can respect them. That's the utmost respect that you're showing to them.
Yeah. And also time, right? Now, if they are giving you the time, you should give them back that quality time that they are asking from you. Yeah, absolutely. Okay. Now, other thing that, practically speaking, every day we do on the mindfulness that I have been practicing and trying to do is mindful breathing. So can you tell our audience a little more about what is mindful breathing? What does that mean and how we can apply that?
Yeah, so breathing comes very hand in hand with mindfulness because our breath is always with us
Mm-hmm.
from the second we are born until we die.
Mm-hmm.
So our breath is always with us. It doesn't cost anything, and it is easy to use anywhere,
Mm-hmm.
wherever you go. So when we are busy and not paying attention to our breath, then we tend to not breathe deeply. We tend to have shorter,
Mm-hmm.
shallower breaths, and those make you more tired.
Mm-hmm.
Whereas when you breathe mindfully, you are able to have deeper breaths
Mm-hmm.
and also able to have better exchange of oxygen and
Yeah,
carbon dioxide and have more energy.
Mm-hmm.
So even smaller periods of time during the day, if you can have some time spending focus on your breath, it helps you getting back into the center
Mm-hmm.
and getting in touch with your inner self.
Yeah, yeah. Even practically speaking, like for myself too, sometimes I tend to speak too fast. And one of the strategy I have done to myself is doing that breathing, right? If I feel that I'm speaking too fast, I tend to take some deep breaths so that I can slow down. Even it give me a little more time to think through too. So that is what one of the strategies I have been personally using is doing some of a slow breathing to help me little more better thinking and also slowing myself down. So that's one of the strategies I personally do use too.
Great, yeah. And you know how when you are breathing, when you are in fight or flight mode, you're breathing fast and your sympathetic system is activated. Whereas when you are breathing calmer, you're in parasympathetic mode and you are in a mode to rest and digest. And that's when we all flourish and become more creative at that time. And be able to connect with others. So a lot of times I would teach some of my teenagers who would be anxious to take a breath in till you count 4, and then from the nose, and then breath out with mouth, and you count till 8. So breath in for 4, and then breath out with 8 count.
Got it.
And breath in with the nose, out with the mouth.
Yeah.
So that helps your body completely change from sympathetic to parasympathetic mode.
Yeah.
And no matter if you are in middle of a panic attack, if you are middle of if you're going for some sort of public speaking event, coming here for the YouTube interview, if you are able to just pay attention to your breath and manipulate even a little bit, that is easier. It's a great tool.
Yeah.
Changing your breath is a great tool to help with the anxiety. But in general, just being mindful of your breath itself, not even manipulating or just watching it, also brings you into presence.
Got it. Okay. And for those who are watching us in a different part of the world, so what we are talking today is the importance of mindfulness. And we have Dr. Dubal, who is a life coach as well as a mindfulness coach, who have been practicing this for many years and using all those techniques in her personal life, as well as helping her patient and even other community around the globe, including North Carolina. So if you are enjoying the show, please comment below what technique you are using to apply the mindfulness in your regular practice, such as breathing exercises, mindfulness eating. So just put those comments in the comment below so that we can understand and share with other people what you are doing. Now, the next section we'll talk about a little more on, let's go a little more deeper on what is the science behind the mindfulness.
Yeah, my favorite part. Being a physician, the science of mindfulness is something that very fascinating for me. Unfortunately, in the last 2 to 3 decades, there has been a lot of research about mindfulness and meditation and how it affects us. Harvard, Stanford, Columbia, multiple universities have been doing research on this. And if you Google it, you can even find the functional MRI pictures of people who have done meditation and their MRI before and after, and it shows changes in their prefrontal cortex. Prefrontal cortex is our brain that is the latest part of our brain that got evolved. So what happens is we tend to, when life throws things at us, we tend to initially, our limbic system starts to act with fear and worry. And when you use your later part, more evolved brain, which is your prefrontal cortex, you are able to think more wisely. You are able to make decision with more discernment and wisdom. And when you practice daily meditation, then those areas of prefrontal cortex become thicker and become stronger. So we can see that with experience, but when you can see that on the functional MRIs, it's pretty cool. I think that you can see it actually on the images.
Yeah, so that means real. It's not made up or some
It's
some
not
other.
a woo-woo thing.
Okay, excellent. Now you mentioned about the 2 part of the brain. I'll just like a little more clarify and make it easier. So what you were telling earlier was the prefrontal cortex, which is made in our body later, which is more of a thoughtful part of the brain. Sounds like it is more a thoughtful part where it thinks. But the limbic system is more reflex, right? It just do it, right? Without thinking, it just do it. And then sometimes those reflexes may not always be the right thing, right? That's what the mindfulness help you grow your better part of the brain, the prefrontal cortex, and then also help calm down the more reflexive part of the limbic system.
Absolutely.
Okay,
yes.
excellent.
You got that.
Okay, so I was just trying to make the audience a little more easier to understand so that everybody is in the same page regarding how mindfulness works and what is the science behind mindfulness. Now, sometimes I personally do get a little more confused regarding the difference between being mindful, mindfulness, and then the spirituality and religious part. So what's the connection? What's the difference between those 2 things?
So religion is something that is made by humans, and mindfulness is more, it's in all religions available in some way or the other. So it's more spiritual experience than certain religious thing.
Okay.
So being mindful and practicing meditation helps you get centered. It helps you get stronger in knowing your inner self, as well as it teaches you how to work with your outer self to make the world more compassionate and harmonious.
Yeah, absolutely. Now, the reason I asked that question is sometimes you might be thinking, oh, I'm not religious, so can I practice mindfulness? So what Dr. Dubal is telling us is you don't have to be religious to be mindful. You can be mindful even without being religious. Is that a correct or fair statement?
Yes. And even if you are religious, or if any religion you are practicing, you could still practice mindfulness and meditation. These are the tools that help us grow as a person.
Yeah. And even for example, like personally, I do chant some of the Hindu mantra. I also read some scriptures, some books. You might be reading Bible or other different religious books. So even that is one of the part of practicing mindfulness, because you are being present with the book. You are being present. You are trying to connect yourself with God or higher self. So it might be part of your mindfulness practice of doing those chanting mantras or reading your religious scriptures or books. So that might be part of your mindfulness.
Yes.
Now, let's change our topic towards how mindfulness works or how it helps with chronic diseases. And as you might know, the room doc, we are focusing more on autoimmune disease, rheumatoid arthritis, but in general, mindfulness is found to be helpful in a lot of other chronic conditions. So let's get a little more clarity from Dr. Dubal, based on her experience, based on her practice of medicine, how mindfulness connect with medicine and then chronic diseases.
Yeah, it is absolutely fascinating. There has been a lot of research done about how practicing meditation and mindfulness daily can help decrease your blood pressure. It helps controlling asthma, eczema, autoimmune diseases like rheumatoid arthritis. It helps with pain of fibromyalgia. And personally, I had experienced chronic pain for many years. I suffer from migraines since I was a teenager. And also, I was in a car accident about in 2007 and broke multiple bones and have a permanent disability from that.
Wow.
So I deal with chronic pain all the time, and I don't tolerate the pain medications very well. So I mindfulness and meditation have been kind of my go-to help for dealing with my pain, and it's amazing to see how it works. The pain doesn't really go away, but it helps you live with the pain with much more space and openness and happiness.
Absolutely. Now that's a very important point to stress on. So pain is not just physical. It's a psychosocial problem where it's not just the physical trauma that caused you to have pain. A lot of the pain signals, when it goes to your brain is what senses most of your pain, so that you can modulate how you are feeling the pain. That's what Dr. Dubal is mentioning about. You can still be having the pain, but your mindfulness technique, some of the other technique we'll be talking more, that can help you make it tolerable. So let's get a little more clear. Let's go a little more deeper on how you handle those everyday regular pain. What are the techniques you use? Because I do see a lot of patients who have rheumatoid arthritis or a chronic condition, they suffer a lot from chronic pain. And in our society, what we expect is an easy pill that can fix everything. But as you have experienced, there is no pill that can fix your pain. But using this holistic way of managing, including mindfulness, we can live a more better and fulfilling life. So let's hear from Dr. Dubal on what she is doing every day to handle those pain, including fibromyalgia pain.
Yeah, so pain plus resistance is suffering. Pain alone is not something that is bad for you, but when you resist it, it causes suffering. That means, oh, my foot hurts. And the next thing my mind goes to, oh, I have a long day of work. How am I going to do this? Tomorrow I have this other thing planned. Now, what am I going to do for that? My day is ruined and I have to take medication, but I'm not going to be able to take certain medications. So our brains ruminate on those things. And when you are able to pause with your mindfulness to stop those stories, stop that resistance and be with your pain. That doesn't mean we have to like pain. That doesn't mean we want pain. That doesn't mean that we want this pain to stay. It's just accepting the fact that the pain is here. And then if you accept and pause instead of resisting it, then what it does it helps you discern in that moment what is really going on right now. Am I just ruminating, making up stories in my monkey mind that is making me more miserable about potential future problems? But right now I'm okay. I have some pain. What can I do to help myself? Do I need to take some Tylenol? Do I need to take another stronger pain medication? Do I just need to stop rushing and sit down, have a cup of tea, and just sit for 5 minutes and center myself, regulate myself from sympathetic to parasympathetic, and see how the pain is? So we are definitely not saying that don't take your medication. Pain medications have their place in chronic conditions and diseases. And a lot of us benefit from us. I have to take my medication as needed. But again, I am not taking it without thinking about it just because I'm afraid what's going to happen tomorrow or tonight with my pain right now. So just stopping, pausing, paying attention. Where's the pain? What level is my pain? And what is my body telling you? What do I really need in this moment? And that helps us make wiser choices in our life.
Got it. Okay, excellent. And thank you so much for being so honest and open what you are suffering and how you are dealing. And recapping on what you just said, I heard two things: pain and resistance will lead to suffering. And that is what you are truly feeling, right? When you have pain, but if you resist those pain, you truly suffer. So it looks like the mindfulness is what breaks that cycle, breaks the resistance. So if you are not resistant to your pain, then you can minimize your suffering. Even though you are having a lot of pain, but if you do not resist, you can decrease your suffering. That's what the summary of what we just discussed.
Yes, and that is actually one of the big Buddhist psychology concept about pain plus resistance is suffering.
Got it. Okay. So we have talked a lot about what is mindfulness, how we can apply mindfulness to our regular practices in general, as well as those of you who are suffering with multiple autoimmune and chronic condition. But as you go to internet, as you start Googling or searching, you will see a lot of information. And unfortunately, a lot of them are not true. So let's hear from the expert who have practiced mindfulness, who is using mindfulness in our own practice as well as helping others. Let's talk about some of the myths that is out there about mindfulness.
Yeah, so mindfulness is not something that is very hard to practice, something that is weird, something that only certain people can do, or you have to be a monk, or you have to be a priest to do that. Those are all myths. Everybody, all of us can practice mindfulness, and it is the tool that is a gift to our human species. And I think there are a lot of misconceptions that you have to sit in a lotus position and you have to sit upright and you have to close your eyes and you have to be a certain way. And all of that is just too critical and very narrow definition of how to do achieve the mindfulness and meditation practice. The most simple mindfulness practices are just you can just sit every day in your pajamas, lay down in your bed or sit in your bed wherever you're comfortable, close your eyes or down gaze and just focus on your breath for a minute or two to start with. And then you can gradually have longer time periods as you practice more, but you don't really have to wake up at 5 a.m. every morning and be a monk and sit in the lotus position and then sit for hours and hours.
Okay. So you don't have to wake up at 5 o'clock. That's the best news, right? So you can even before you go to bed, maybe that might be a good time that works for you. Even during the middle of your lunch hour, you can do some mindful meditation, and you don't have to sit for hours. Few minutes will do the trick. So don't get discouraged if you cannot sit for a long period of time. Start slow. Start with few steps. Start with few minutes, and then you can slowly, gradually, you can increase your time. And then a lot of my patients, they do come with a lot of anxiety, depression, and they say, oh, I'm very anxious, I cannot meditate, I cannot be mindful. How can I be mindful if I have a lot of anxiety? What's your response to those patients?
So, anxiety is nothing but a form of fear, because when you are thinking about future all the time, that's when you end up having anxiety. When you are stuck in the past a lot, you end up having depression, just to make it very simple. So, when you are in the present moment, whatever you're thinking about or worrying about is not really there. So, if you're able to bring yourself back to your present moment, you are not going to feel as much anxiety.
Mm-hmm.
You're going to be able to clear your mind and realize that, oh, yeah, this is what's happening right now. And there might be consequences that might be grave or not so grave, but right now I'm okay.
Mm-hmm.
So just coming back to the present moment, being mindful and practicing that helps us not get carried away in the future worries.
Mm-hmm. Okay, so the take-home message I got from this conversation is be present. You don't have to be thinking too much about your past, or you don't have to make too many plans for the future. So just be present. Try to live what you have at this moment. I think that's might be the essence of mindfulness. Now let's switch our gear a little more, and we'll talk a little more about the mindfulness, but let's focus back on you. Like, tell us a little more about yourself, your journey so far, your practice of pediatrician, now in a different setting. So tell us a little more about how you are doing, how are you spending your retirement?
So I started practicing pediatrician for 25 years, and I absolutely love what I do. And in 2017, when my daughter was in high school, I started practicing meditation again, which I used to do on and off, but more regularly in 2017 when she was in high school and I needed to be more present as a parent so I can regulate myself and I can support her in her journey. So that's when I started more regularly, and would start with 2 minutes, 3 minutes, 5 minutes, whatever time I had, whenever I had the time, and then gradually increased. And um, after that, a couple of years ago, I decided that I want to deepen my practice. So I um, planned to become a meditation teacher and took a course for 2 years with Tara Brach and Jack Cornfield. And we learned how to teach mindfulness and meditation to others. And my intention going into the training was to deepen my own practice, but the way it helped me so much
Mm-hmm.
that I had very clear information that I need to spread this
Mm-hmm.
information. I need to tell this
Mm-hmm.
about this to others and help others, because such simple tools. And if we can use that in our practice, in our daily practice, the quality of life is
Mm-hmm.
so much better.
Yep. That's the point, right? What we do as a doctor or any other practitioner, we need to improve the quality of life of ours and the quality of life of our patients. Now, as we say, you cannot pour from an empty cup. So as a healthcare provider, we have to fill our cup. And one of the way of filling the cup is looks like the mindfulness and the meditation. Now that segues to our next segment where we talk about how we can use the concept of mindfulness for healthcare providers, how we can be mindful to our patient, how we can be present with our patients.
Yeah, great question. So, especially since going through COVID, all of us healthcare providers have felt a lot of stress and burnout. And even if we don't label it as a burnout, the symptoms
Mm-hmm.
and signs are of burnout that you can pick up from anybody, any healthcare provider you ask. So I'm one of them. And even though I absolutely love what I do, there were days when I really was like, oh, I don't want to go to work today.
Mm-hmm.
But I want to take care of my patients. I
Mm-hmm.
just did not like everything else that came with it, all
Mm-hmm.
the management part and all of that. And then I did not like the feeling of how I felt when I didn't want to go to work
Mm-hmm.
because of the stress of everything else.
Mm-hmm.
And when I started more regularly practicing my meditation and mindfulness, I was able to go to work and um, continue to enjoy the part of the work that was the most rewarding, which was taking care of the patients, and then also navigate and manage the part of charting
Mm-hmm.
and management and dealing with the staffing and all of that day-to-day issues. Um, that made it more bearable
Mm-hmm.
and tolerable. And I wasn't feeling like I don't want to go to work anymore because I enjoy taking
Mm-hmm.
care of my patients.
Got it. Okay. Now, as many of the healthcare workers who are listening to us, or healthcare provider who are listening to our conversation, let's also quickly go over some of the practical tips, the practical tools they can use on an everyday, day-to-day practice on how they can be mindful when they are seeing patients.
Yeah, so we have, unfortunately, the way our medical system is in the United States, we are forced to move really, really fast, and nobody has time. No provider has time to spend with patients, and most providers actually enjoy spending time with their patients, but the system does not allow you to spend more time. So what we can do is using the mindfulness and being focused on what is it that I really want from this interaction
Mm-hmm.
with my patient. And before going into each next patient's room, I would just pause, center myself, take a breath, and then go in. Just a small act of pausing was very helpful in being able to be more present and not just looking at my computer
Mm-hmm.
or writing notes, but actually continuing to engage with my patients and their parents. And that did end up having me to do more work at home as far as charting goes.
Mm-hmm.
But I still was feeling very
Mm-hmm.
fulfilled, which
Got
was
it.
more important to
Yeah,
me.
yeah, yeah. And based on my own personal experience, I used to feel the same way when I was practicing a couple of years back. Now, thanks to the AI, which I use it every day, the AI helps me do the charting so that I can be truly present with the patient. I don't have to write the notes. I don't have to get distracted with the EMR. That has been a blessing so that I can truly be present with the patient. Whatever they are sharing with me, I can grasp all of those details. I can truly connect with them. And that also helped me connect with them so that whatever treatment decision we make, they truly understand those and they truly follow those instructions. So that has
Yeah.
definitely transformed the whole way how I practice medicine these days. So that is one of the blessing that I feel that the AI has given
Yeah.
me, is
Blessing of the technology.
blessing in disguise. So it has truly given me the time that I can stay focused with the patient. So that is blessing in disguise for us. Now let's go to summarize our session. As we talk today, we are talking about what is the importance of mindfulness for patients who are dealing with chronic conditions like rheumatoid arthritis, fibromyalgia, and many other chronic conditions. We also talk about how you can use mindfulness in your day-to-day practice, like mindful breathing and even mindful eating. Those are the two important tools that you can use every day with your life. Now, as we are talking more about rheumatoid arthritis, one key thing I need to focus and we need to focus on is mindfulness doesn't cure your RA, but it can help you handle the day-to-day stress related with rheumatoid arthritis or any other chronic condition. If you are less stressed, you can handle your disease better. You can take your medication more regularly. That will complement all the treatment that you are getting from your doctor. So let's not just substitute mindfulness for all your medication, but let's use as a complement to help you feel better with overall improvement in quality of life. That is the overall message from our conversation today. Now, Dr. Dubal, do you want to add few like practical tips that our patients, our healthcare provider, and other who are listening to us can do in a day-to-day basis to be mindful?
Yes, so mindfulness practice is formal and informal. There are two main ways to do it. Formally, you can sit down and close your eyes and focus on your breath or any other part of the body, whatever works for you. And then there are many guided meditation apps available out there. On YouTube and other apps. So you should be able to find something. If you are not able to comfortable practicing meditation on your own, use a guided one. There is no right or wrong way to do it. You cannot do meditation wrong in the end. That's the bottom line. That's the message to take home. You cannot do it wrong. Take a minute or two or 5 or 15, whatever time you have in your day, sit down and practice centering yourself. And then rest of the day informally, just whatever you're doing, try to remember, stop, pause, be present, and then continue to do what you're doing. And if you pair those pausing moments, informal pausing moments, with a daily activity that you do every single day, you'll remember to do that. If you decide that, okay, I'm going to be mindful every time I wash my hands. So every time you wash your hands, you remember that and just focus on washing your hands and not anything else. Every time you are going to get in your car, before you turn the car on, pause, and you are able to be there for a split second. Be present, and then move on. When you practice your sitting meditation and informal meditation of mindfulness moments, they both complement each other. So when you practice one, the other one gets better. And when you practice the other one, the first one gets better. So for me, the biggest aha was when I realized, like, sometimes I have only 5 minutes to sit, and it's okay to do 5 minutes, but then during the day, I do have multiple opportunity. And another most important message is, if you miss your meditation practice or if you forget, it's okay. Be kind to yourself, be gentle to yourself, and there's always next day.
Excellent. And then 2 things that I remember from the conversation is mindful eating and mindful breathing. If you can start with those 2 things, which are very simple, but you can do every day. So mindful eating and mindful breathing. Now, before we conclude the session, can you tell us, our audience, how they can reach out to you if in case they have any concern, if they want to connect with you, how they could connect with you?
Yeah, you could reach out to me at my website, niralidubal.com, NIRALIDUBAL.com. And there's a way you can send me a message to connect, and I'm happy to help you answer your questions.
Excellent. Now, if you have any questions about mindfulness, if you want to practice mindfulness, definitely reach out to Dr. Dubal so that you can learn from our expertise. And for all those audience who have been watching us, listening to us, thank you so much for your valuable time. I hope it was helpful. And we talk about a lot of practical tips. And to get more information like this regarding mindfulness and other techniques that can help you deal with your chronic condition, including rheumatoid arthritis, please like and subscribe so that you will get notification of any new videos like this that we'll be producing in the future. And we'll be coming up more sessions like this where we'll talk about a lot of the conditions related with rheumatoid arthritis and other chronic conditions that we can help you feel better. And if you have any other comment, please put them in the comment below. Let us know what type of practice you are doing to be mindful, and how it is helping you, and how it is changing your life on how you manage and treat your rheumatoid arthritis. Thank you so much for watching, and we'll be coming up with more videos in the coming sessions.
Thank you.
Thank you, Dr. Well, for coming over. We'll see you next time. Bye-bye.